There we go.
Hello, my name is Misty Beach, and I am doing my persuasive essay on how important it is to get routine skin checks done by a dermatologist. The importance of skin checks for individuals are advised at least yearly, maybe 6 months depending on treatment they've had in the past. Dermatologists have been trained to look for the different types of skin damage. The UVA and UVB radiation can cause damage to the skin in many different ways. If not treated, can cause skin damage and/or death. Dermatologists and other healthcare providers have certain concerns regarding the danger of UV rays. There are two types of UV rays. You have UVA and UVB. UVA, which is ultraviolet A, is deep penetrating, causing sun damage. UVB, which is ultraviolet B, is sunburn damage. Dangers in tanning. The UV radiation from the sun, tanning beds, and sun lamps can cause sun damage. This type of radiation can cause damage to the immune system, premature aging, which is causing wrinkles to the skin. Some sun is good, giving the body vitamin D. Vitamin D does not take much sun, though, not enough to give an individual a tan or a sunburn. People that are affected by the sun increases over the years. More than 1.3 million individuals are likely to be diagnosed over the year with skin cancer. Most often, 80% of sun damage occurs before the age of 18. Any skin damage takes years to show after the exposure of the sun. One type is called precancers. This is an actinic keratosis, which is not a skin cancer, but it is a precancer, which usually occurs on the face, the lower arms, the back of the hands. They usually look like pink, scaly spots. If not treated, there's a 10% chance that they can turn into a skin cancer. Treatment of an actinic keratosis is either chemotherapy, which is with liquid nitrogen, where they freeze the spot to kill any of the precancer cells, or prescription medication, which has an acid in it to chemically peel off the skin. The first type of skin cancer, here's a picture of actinic keratosis. The first type of skin cancer, which is basal cell carcinoma, which is a small fleshy bump or nodule, appears on the head, the neck, and the hands. The most common type of skin cancer. This type of cancer does not spread quickly, but if untreated, will begin to bleed, crust, and it'll heal, and then it'll start its cycle all over again. This cancer, if found early enough, can be treated through an excision, but it does not often metastasize, so its roots can extend to the bone, which can cause a local damage. Here's a picture of the basal cell carcinoma. The next type of skin cancer is a squamous cell carcinoma, which appears as a bump or a red scaly patch. This is the second most common type of skin cancer, which usually occurs on the face, the lips, and the mouth. This cancer can metastasize, but can be treated properly if found early. This treatment, as like the basal cell carcinoma, has a cure by a dermatologist of 95%. And there's a squamous cell carcinoma. The most dangerous type of skin cancer, which is the most deadly, can be melanoma. Annually develops on the skin of 44,000 Americans. Every year, an estimated of 73,000 Americans die from this skin cancer. This cancer is almost curable if found early. That's why routine skin checks are very important for individuals. Melanoma appears in mixed shades of tan, brown and black, and sometimes red or white. Melanoma spreads, making treatment a little difficult. This cancer can go into the lymphs of an individual, which usually, when melanoma is found, an excision is scheduled, and the lymph nodes are actually checked and sometimes excised. Melanoma can appear near a mole or other dark spot of the skin. And if it's found early, it can be removed. But if not, it can spread to the lymphs, which can cause possible death. Melanoma cancer can occur anywhere in the body, the feet, the palms, underneath the nails, in the mouth, anywhere. Usually warning signs of a melanoma in a mole is scaliness, oozing, bleeding, pain, tenderness. And here's the ABCs of melanoma, What you want to look for is the asymmetry, the border irregularity, the color, and change in diameter. You usually don't want it to get any bigger in any way than 6 millimeter. Usually individuals are advised to visit their dermatologist at least yearly. If they have a cancer, then they are advised to visit their dermatologist every 6 months, maybe 3 months, depending on the treatment and the type of cancer they have had. Dermatologists will do a biopsy in the office if they find any spot is suspicious, unusual, itching, or bleeding. If a cancer is found, then the treatment is either usually through an excision, liquid nitrogen, or a Mohs. And these tests can be done by a physician, a dermatologist, or a plastic surgeon, depending on the type of cancer and the type of treatment that is needed. Dermatologists recommend individuals to do routine spot check on themselves at least a couple days a month. Individuals who notice any changes are advised to see their dermatologist. And that's pretty much it. So individuals need to see their dermatologist at least yearly to check and make sure that they don't have any signs of precancers or cancers. And if so, if the treatment is caught early by yearly exams, these cancers can be caught and they can be treated before they get to an extent before it turns into a bigger procedure and possibly like melanoma can cause death. Thank you very much.